So good morning all. The topic that we are going to cover today is physiotherapy management in COVID-19. Our main focus here is going to be PT management in ICU settings. We have with us Dr. S Moorthy, an esteemed physiotherapist from All India Institute of Medical Sciences, New Delhi. Dr. Moorthy has an experience more than 20 years. He has completed his bachelor's from Dr. MGR University, Tamil Nadu, master's in orthopedics from CSS Meerut, followed by PhD from All India Institute of Medical Sciences. He has been very active in the field of research and he has more than 20 national and international publications to his name. He and his team are a part of the COVID task force at All India Institute of Medical Sciences and are treating COVID patients in the ICU settings. In other words, I would call them COVID warriors. We are proud of you, sir. We at IAP Women's Cell Goa, thank you for accepting our invite and agreeing to share your knowledge with us. I would also like to, request everybody. Currently, let us switch off our audios and videos. But at around 10:15, we would all switch on our videos and would like to pay our solitude and gratitude both towards all the COVID barriers. So I request at 10:15 we'll do that. And currently, over to you, sir. You can share your screen and let's get started with the session.
Yes, thank you, Dr. Das, and being a good platform for me to present the role of physiotherapy on COVID patient in ICU setup. So, as you know, most of our physiotherapists are posted in ICU setup as well, or we went as an internship in ICU setup. So, the ICU, everyone knows that in ICU, we have an important role by doing chest physiotherapy or limb physiotherapy, early mobilization. But anyhow, from health ministry, they omitted our services. But even though we fight with these people, and now as a physiotherapist, we are posted there and we are delivering our services to the COVID patient. So today, I just want to share my experience of the role of physiotherapy in COVID patient in ICU setting. As we know, current situation, everywhere we are listening, we are watching about coronavirus. It's a large family of virus which may cause illness in animal or human. In human, these coronavirus are known to cause respiratory infections. It's like common cold, severe respiratory problem, such as MERS, that is called Middle East Respiratory Syndrome, and severe acute respiratory syndrome, called it SARS. So the main causes is COVID-19, that is recently discovered, and it is an infectious disease, and it characterized as a pandemic due to rapid increases in numbers in all the countries. Nearly 180, 190 countries, it's already spreaded. So what is the common symptoms? As you know, is fever, dry cough, and tiredness, body ache. Some patient may get nasal congestion and sore throat or diarrhea. So those who get positive in coronavirus, generally 80% the people recover without need of any hospitalized or any ICU set. So 80% population, they will recover themselves by taking symptomatic treatment like fever, some other. And we have to think about who are all the affecting person, population. Generally, it is categorized two group of people at the high risk of getting the severe COVID-19. Who are all they? One is older population, that is called geriatrics, about 80 years, because they have multiple issues. And the second people is those who have chronic illness, that is called chronic liver, diabetes, cardiovascular problem, chronic problem, cancer, and hypertension. So that what we call is comorbidity. So this virus is transmitted from person to person through respiratory secretion, that is called large droplets, by coughing, sneezing, running nose. So it's within 2 meters of the infected person. So this infected droplets will while at least 3 hours, according Van Dormelen et al. Is published in the New England Journal of Medicine 2020. So these infected droplets will remain viable in air at least 3 hours. So we should take care of health by hand wash. And this virus is also transferred person to person by hand contacts. One more study shows we as a person 23 times per hour we are touching our mouth, nose, eyes. So this also the matter of spread of the coronavirus. So for example, like those who are infected the coronavirus or COVID-19, they have some other illness like fever that indicates 89%. According Gulen et al. 2020, they published New England Journal of Medicine 2020, and they mentioned up 68%, fatigue 38%, and sputum production, that is 34%, and shortness of breathing 90%, according these studies. And as I earlier told you, that 80% of asymptomatic or mild without any hospitalization, they can treat. Even the government advice, they can quarantine themselves. As per the norms, they can take a person support. So the 80% is asymptomatic and mild, we can treat ourselves according to the condition. And 15% of the positive COVID-19, they need hospitalization for oxygen support. And 5% of critical require ventilation, I mean to say, they need ICU setup, ventilator support for their life support. So here we are concentrating as well as 15% the population, those who need hospitalization, and 5% of 5% of population, those who are admitted in ventilators, ICU setup for their life support. So here we are concentrating 15% of population as well as that 5% population by doing our expertise like chest physiotherapy, limb physiotherapy, and further precautions. And as I told you, this 80% or 15% and 5%, this according to the WHO reports. So how to do the investigation? As you know, the oral pharyngeal swab, nasopharyngeal, and endotracheal aspirate. So this swab we can find out the investigation. And one more, the the lung CT scan find out the early diagnosis and early diagnosis from the differential, some other issues related with respiratory problem. And if you find, for example, you can see the figure A, you can see there is whitening that shows ground glass opacity, and you see the dorsal area of the lungs get problem due to gravity and due to the positioning. So here the role is our role is very important. How to recover from this level, and on the bedside we can do lung ultrasound also to find out the lung consolidation or multi-level distribution of B lines. So these also recent studies, as I mentioned in the slides, Peng Q Y et al. 2020, he published in the Intensive Care Medicine 2020. So this is our ICU, which dedicated X-ray machine, CT machine. Even we have ultrasound also. We do the instant status patient condition. So as I told you, differential diagnosis. So the early CT scan to find out the differential diagnosis for COVID-19, because the same symptoms happen in those listed conditions like influenza, other coronavirus, SARS, MERS. So the CT early CT scan, early screening, so we can find out the differential diagnosis for COVID-19. So this is the sheet of knowledge. What is the initial stage uncomplicated illness? Like the patient with uncomplicated respiratory tract viral infection may have non-specific symptoms of fever, cough, sore throat, nasal congestion. So this is an uncomplicated, which it can be required themselves. And this is a mild pneumonia. So here medical person have to address the patient with pneumonia and no signs of severe pneumonia. In child, non-severe pneumonia has cough and difficulty in breathing. To contact the medical person, medicine doctor, so they will recommend you certain medicines. So this is a severe pneumonia which need hospitalization. That, as I told you, 15% of population need such a problem, that is suspected respiratory infection plus one of the following issues above the 30 breaths per minute, severe respiratory distress, or SpO2 below the 90 on room air. So these population need to be addressed. This population need to be admitted for oxygen support. For child with cough or difficulty in breathing, plus at least one of the following, like central cyanosis or SpO2 below 90 severe respiratory distress. This population has to be admitted in the hospitalization for the oxygen support. So this is next, the ARDS, this is the next version, next adverse problem, the worsening in respiratory weak. So this kind of patient we can diagnose by doing chest imaging like radiograph, CT scan, and ultrasound, as I already shown the X-rays. So in CT scan we can find out the grounded glass opacity. So this is why it happens, why whitening in the certain patches. So just because of this virus affect the hemoglobin. So due to that, so there is the patches of ground glasses opacity in the CT scan and as well as in the X-rays. So and we can find in the ultrasound the lung consolidation also. So such a patient, what we have to do? What is a therapeutic mode? By supplement of oxygen therapy immediately to the patient with severe acute respiratory infection and respiratory distress, hypoxia or shock. So initially we have to give 5 liters per minute, and at reach targeted at least SpO2 saturation above the 90° in non-pregnancy adults, and the saturation should be more than 90 to 95 for pregnant patients. For children with emergency signs like breathing problems, severe respiratory distress, central cyanosis, shock, coma, or convulsions, so they must receive oxygen. At least the saturation should increase more than 94%, and also use conservative fluid management like IV fluids, and the antimicrobials to treat all pathogens causing respiratory issue. Any query?
Sir, I would like to disturb you for a minute here. And as I was talking, that today our government defense is also giving their gratitude and showing solidarity. So I would request everybody to please switch on your videos and let's have a 10-second clap for people like Sir who are going as COVID warriors and supporting us all. Everybody switch on their videos.
இது ஒன்னாக்கு இப்போ ஒரு மாசம் இருக்குப்பா ரெகுலரா ஓடிட்டு இருப்பாங்க.
21 days ஃபாலோ பண்ணா நமக்கு ரெகுலர் ஆயிடும்.
அத இப்போ என்னன்னா இப்ப சட்டில் இல்லனா கூட
host has actually blocked my video.
பிளான் பண்ணி வச்சிருக்கேன்.
You're not able to switch on the video.
Okay,
What's the problem?
We cannot start the video because the host is disabled there. Message coming.
Switch on videos, everybody. Rashmi, are we good?
I'm resuming my slide. So use conservative fluid management like IV fluids. After that, I'll explain the physiotherapy role.
Give me like 10 seconds. Sir. If you can hear me, just give me 10 seconds over here. Everybody to switch on their videos.
Antimicrobials to treat all likely pathogens causing SARS. We should concentrate. Corticosteroids will adverse effect in this situation. No study will support. No study corticosteroids being such a condition. Sepsis condition advise corticosteroid for the life-saving drug. So this also is a part of physiotherapy. So how the oxygen therapy is giving for such patients? For severe hypoxic respiratory failure with respiratory distress, we have to give face mask with reserved bag at the rate of 10 to 15 liters per minute. And this we can find within an hour whether the patient gets recovered or getting bad position by doing ABG, arterial blood gas analysis. So then the next step we can go high flow nasal catheter oxygenation or non-invasive mechanical ventilation. This also can do 1 to 2 hours. Within these hours, we can find out the patient whether it is getting recovered or getting bad. So by doing the ABG values. So in this, for example, the patient is getting worse, then we have to do very fast mechanical ventilation. I mean to do tracheal intubation and or invasive mechanical ventilation. That is ventilator support. These are basic values. That lower tidal value should be 4 to 8 milliliter per kg predicted body weight, and the plateau pressure, which is 30 centimeter under water pressure. The plateau, what is plateau pressure? This is lower inspiratory pressure. This pressure is generated by the ventilator to the alveoli and small capillaries of alveoli and small capillary of breathing tubes. And moreover, the higher PP, positive end pressure, positive pressure. So this also be recommended in this severe respiratory distress patient. So here, the role of once the patient is intubated, so they have a chest problem, secretion problem, and ICU acquired weakness, that is joint stiffness, muscle weakness. So we have to address this patients, those who are admitted in ICU and intubated or ventimas. So how? By doing the chest physiotherapy. So here, according to Kress JP and JB Hall et al., he mentioned that ICU acquired weakness and recovery from critical illness. He published the journal England Journal of Medicine 2014, and this will lead morbidity and mortality. Here author already mentioned as a Heriday MS et al. 2000 found. He also published in England Journal of Medicine 2011. So here we have to address two. One is chest physiotherapy and limb physiotherapy. So how to do? By doing some, as you the chest physiotherapy, by doing techniques as percussion, shaking, vibration. So this will gain the productive cough and to clear the secretion, because the patient can't able to independently clear the secretion. So these patients need vigorous chest physiotherapy by doing our techniques. But here I am doing a chest vibrator to loosen secretion. So this is how we are doing a chest vibrator for the COVID intubated patient. And moreover, this patient, yes, this is a vibrator. Once again, I am repeating this slide. So this is a chest vibrator loosening the secretion. So this, after this chest vibrator and the manual that's our technique. We do the close section. Generally, as you know, suction we have two types. One to disconnect the ventilator, and another, this is a closed section. So in this situation, we don't want to disconnect the ventilator to avoid the infection, because we are very proximity to the patient. So this is advisable. The section is closed section. So once again, I'm just running this video. That this is a patient, medicine, drug-induced coma patient. So such a situation, so we have to make it coma by drug-induced, so for their good recovery. So this is one more device which we have only two devices, and this device we are not using in COVID. Generally, we used to do in our rest of patient like cervical injury, high-level cervical injury patient, and fracture patient. We can't do effective cuff, and it works as a cuff assisted device. So it gives positive pressure followed by negative pressure. The positive pressure gives 40 mm pressure under water. The same pressure, the negative pressure, the same 40 mm under water pressure. So this to initiate the cuff mechanism. So, but we are not using this equipment in COVID. Why? Because if you use this machine, we have to disconnect the ventilator, and we have to put the patient as isolation, because in ICU we have 16 bedded So we are not using this tough assistive device. For your sake of knowledge, just I'm showing. And as I told, WHO mentioned that early rehabilitation, early mobilization will help, will promote rapid functional recovery. And also we have a role in exercise, mobilization and rehabilitation intervention to survive of critical illness associated with COVID-19 in order to enable a functional return to the home. As I mentioned, early mobilization is important to avoid re-intubation. So we have to do as soon as possible. As soon as possible, we have to do this is early mobilization. So before 2-3 weeks before she was under ventilator support. After that, she got anti-mask. After that, right now she is this condition before 10 days back. So now she started doing exercise. This dedicated COVID ICU. So I think short of time we just running. So this and moreover those who are ARDS. So we have to put prone position according to the Australian and New Zealand Intensive Care Society. According to these guidelines, we have to put 12 to 16 hours in prone position. That is recommended. So we are doing the same thing in our ICUs. And so this WHO guidelines. After the therapy, we do the sterilization with us to prevent COVID-19. And keep in mind, social distancing is important. Wearing mask, hand hygiene at least 20 seconds. Improve immunity by taking green vegetable sprouts, vitamin C, vitamin E, vitamin D, and do regular exercise. Stop smoking, stop alcohol, stay home, stay safe. Doing regular exercise. We should recommend some stretching exercise to our patients, because right now due to lockdown we are not treating, we just getting call from the patient what we have to do. Humko gardan pe dard ho raha, kamar mein dard ho raha. So for that I made 11 videos for the patient, not for the professional. So the video is uploaded in this YouTube channel, 6 Space Physiotherapy, where you can get 11 videos. One is back pain, neck pain, knee pain, heel pain, flat foot, even hangover also I have posted. The purpose is, we are not treating due to the lockdown, we are not treating, the patient is not coming to our clinic for the sake of social care, the sake of the patient healthness. So this video will help. If you want to recommend, you can recommend this video, because this is totally the basic and totally for the patient purpose, not for the professional purpose. So and more I explained the basic exercise, that stretching exercise. After that, by the week, 2 weeks after that, they can contact you. They can upgrade your protocol, upgrade the exercise or technique or electrotherapy, whatever it may be, according to your convenience. So this is a basic which your patient, the society get benefited. Thank you so much. Hello. Thank you.
I request everybody, please switch on your videos. So thank you so much for giving this talk. We want to show our solidarity and gratitude towards people like you, and that is the reason we have asked everybody to switch on their videos. I want everybody to show a salute from there. Anybody who is having problem with switching on videos, please raise your hand.
That is for you, Dr. Moorthy, and your COVID team in it from Dr. Anjali.
We will be taking the question and answer after this. Please switch on your videos. Rashmi, are we good?
Yes.
I request everyone, please switch on your videos.
And please
We are
salute.
sending a request. Yeah, this is going to be on mute because we'll take the questions after that. So guys, we start with a salute over here to all the
Thank
COVID
you.
warriors.
Thank you.
Thank you so much,
Dr.
sir.
Moorthy, more power to you.
Thank you. Thank you. Thank you. I am working behalf of our population, physiotherapy population.
Thank you, sir. Rashmi,
Yes.
shall I go ahead?
Please go ahead. Yes.
Okay. All right. So we will be starting with question and answers right now. The video might disconnect, but please remember to again come back to the same link and we can again join the video. We will be taking all the questions now. So, sir, first question is fumigation needed for OP clinics even after surface disinfection is done with sodium hypochlorite solution?
Yes, definitely. Actually, right now in our clinic, in our ICU, they are just maintaining the negative pressure by running a high power fan, high power exhaust fan. What I can say you. So this is ideally advisable, and moreover, they're doing regular cleaning, fumigate the ICUs.
Rashmi, next question, please.
Voice is not audible.
Yes, doctor, can you hear me?
Yeah.
So, how can we separate the PPE kits for different patients, or it's one use only?
Voice is echo, ma'am. Can you repeat the question?
Yes. Can you hear me now, doctor?
Yeah.
So, doctor, can the PPE be reused? And if it
All
can,
the questions are on the chat box.
can the
Please.
PPE can be sterilized? Monica, please ask the question.
Yes.
Doctor cannot hear me clearly. Can you
Yeah, actually, your voice is echo, na? So the voice is
So you are
repeating
not
twice. Na?
audible to us.
Yeah, please go ahead.
So, doctor, can the PPE kit be reused?
PPE kit?
Reused or sterilized? How can we sterilize?
No, that is not reusable. That is use and throw. PPE kit is use and throw. The only which we use to use the goggles and face shield. That is the both thing is reusable. Rest all use and throw. PPE kit and N95 mask.
Can surgical gloves be reused for the week?
Yeah, definitely. In those days, I got it. When I posted in ICU in Neuro 2005, at that time this gloves was reusable. So now, due to advance and maybe well infrastructure, nowadays we are not using gloves as a reusable. We discard after use. but you must know the color coding. Like for example, that pink color, as you know, the infected gloves and all we have to put into the red or pink color dustbin. So the gloves won't use reusable.
Doctor, what would be the frequency of chest physiotherapy when given?
We used to give 2 times a day. One is 10 to 12, and the second shift, the second round is 3 to 2:30. Between 2:30 to 3:30, we used to do second time, and we are doing just 12 hours duty, not 24 hours around the clock due to shortage of staff, and moreover we have to minimize and we have to prevent the infection. We have to do. So, but we are covering at least 12 hours, and right now we have 6 intubated patients, and four patients are ventimas room air. So, as we have a 6 physiotherapists, we are doing a morning evening shift. So, hope doing well.
Yes, doctor. Thank you. Doctor, are you following the broad dyspnea scale?
Can you repeat your question?
The question is, are you following the broad dyspnea scale for COVID breathlessness?
Should I ask that question?
Yes, please.
Yes, ma'am.
Yeah. So, Dr. Moorthy, we used to follow a Borg dyspnea scale for breathlessness. Are we also doing it for common patients who are not breathless enough for general clinics, the Borg dyspnea scale?
That can be possible, ma'am. In the general clinic, in ICU, we have to make. Actually, right now we are treating in ICU only. We are not started as a ward patient. If we started in ward, definitely we can use this scale right now, because as we have to consider about our health also. So we have, because you see, avoid infections. In ward we can do it, no issue. But right now we are not using.
Thank you. Thank you so much.
Thank you.
Doctor, what to do with older patients where the prone position is contraindicated?
Yes, ma'am. Because as I told you, two group of population get affected. That is 70 plus, and those who have a comorbidity like diabetic cardiac problem. Definitely, as per the WHO, we already the practicing the prone position with the ventilator, because every bed has the hole on the head side. If you put on the prone position, we are not facing any problem. So we are doing the out of 24 hours, 12 to 16 hours, we are following the prone position.
What about a ventilated patient?
Yes, that's what I'm saying. That's what I'm saying. If you see the ICU bed, on the head side, you have a hole. In fact, we can see in the traction bed also, no?
Yes.
So in that hole, we are taking the leads and the tubes to the ventilation, ventilator support. So ventilators patient, generally ventilator patient is get ARDS now. So we are practicing in prone position.
Doctor, what would be the post-discharge protocol?
Ma'am, once the patient is stable, I mean to say, if you saw the video that the female is walking, so she is ready to discharge. Already we have discharge. The thing is, the blood result shows the COVID positive. So now we discharge the patient and we under our control, and we put her into the quarantine for the 15 more days. So after they get negative report, then we send the patient to their home. Meanwhile, under our control, we have enough space. So we are doing our service. And post-discharge, and after once they discharge from the ICU, the stable patient, we recommend to do the spirometer. The spirometer also not forceful movement, very gradual. because they can't able to do because they have less lung capacity. So we give spirometer as I didn't run the video due to the shortage time. So we are practicing and we recommended the pulmonary rehabilitation.
Yes, doctor. Just wait for. Doctor, there's a question. What if the ICU bed doesn't have a hole? Can you still put them in the prone position?
Can repeat?
Doctor, if
Hmm.
ICU bed does not
Hmm.
have a hole to put your face in, will you still be able to turn them into prone?
Yes, I'll do one thing. I'll post the photography. I'll post the photography that the ventilator connected patient, how we put the into the prone position. I will post
Thank you, doctor. Thank you.
because right now we have two patients. That is obese patient, female patient. We are doing the prone position to them. So we are practicing.
Thank you, doctor. Anything you'd like to add, doctor?
Uh, just go through this. Actually, I just want to emphasize that in lockdown, we should concentrate, we should take care of our patients because as a physiotherapist, we have at least 10-20 clients, patients with them. So they need some advice so that they can live without pain. For that purpose, I did this the videos for the home for the patient purpose. Please recommend these videos to the to your patients, those who have problem. So definitely, even this will help to them. So thank you for your good platform. Thank you so much.
Thank you, doctor, for your time and your effort. Let's keep in touch, and I hope in future also you'll come back with us and give us more information.
Acha, these questions, okay, I will reply.
Yes, please.
Someone asked, please post the picture. Okay, and actually, yeah, no. What if the ICU bed doesn't have a hole? Is there any still? Yeah, you can put pillow also. You can put pillow on chest, so you can get enough space on between the bed and face. So that can also be. But generally, every bed that has, if you running a dedicated ICU, then definitely you have to get such bed only. And there's some other question.
So will you be sharing the examples of the CT scan of lung consolidation? Will you be able to?
Right now I don't have. Yeah, definitely I will post. But I have to get from my hospital. I will get it and I will post you. I will send it you. You just please share this video.
Yes.
Right?
Yes, doctor.
Thank you, ma'am.
Thank you so much, doctor.
Thank you.